Phil Rainier, Vice President of Communications at Premier Health. Today in Premier Perspectives, we're joined by Premier Health team member Barbara Peacock. Barbara is a nurse practitioner at South Georgia Immediate Care in Statesboro, Georgia, which is part of the St. Joseph's Candler Urgent Care family. Barbara, thanks for joining us today.
Thanks for having me.
How long have you been at SJC Urgent Care, Barbara?
Since June of 2022, so going on about 8 months.
And what's your impression? Tell me what it's like to work with your team there and to see patients in an urgent care setting.
Well, this is not my first rodeo. I've been around healthcare for many years, and I thought I had seen and heard just about everything, but then I walked into urgent care and realized that there was so much more for me to see and learn and stories to hear. But I enjoy the care and the people and the teamwork from the front office staff, like the CSRs. I tell them daily, I couldn't have your job. I mean, I'm so thankful for them because they're the first impression for the office, and they kind of sets the tone for how the visit's going to go. So they set that up for me and answer phones and had the patience of I don't know who to tell people how to get to the office and how to navigate the whole system. And then there's the clinical team, and they are just vital. So I spend a lot of time, coaching them and helping them and showing them how to just narrow down on patients' complaints, because if they can zero in on why the patient's there and give me a good medical history, then when I go into the room, it just makes my visit much more efficient for the patient.
What made you want to be a nurse practitioner?
Well, it started back when I was 13, and I won't tell you how many years ago that was, but it was some years ago. My uncle was in the hospital sick, and I was in the 8th grade, and I told my mama, I said, I'm going to be a nurse. That's what I'm going to do. And I never faltered in that.
What does making a difference mean to you? What does it look like to you?
I think at the end of the day, what I want to feel like I've done is that I've seen people who've come in with a problem that's important to them. Like maybe they're the 30th patient I've seen today who's had a cough, congestion, a sore throat and doesn't feel good. But I want them to feel like I listened to their problems and their situation, because oftentimes these patients aren't there just because they feel bad. Like I had a lady the other day who said, I can't feel sick or be sick because my husband is on chemotherapy and I'm his provider. Very short, I just hope that when they walk out, they can look back on that short little experience and feel something positive about it, that it was a good, that I listened to them and I'm going to help them with their problem.
Okay, great. Well, thanks very much for talking with us, Barbara. Thanks for being a valued member of the St. Joseph's Candler Premier Health team.
Thank you so much.